My name's Margaret Garbett, and I'm the chief nurse at UHB here in Birmingham, so not quite Wolverhampton, but a little bit farther down the road. I'm really, really honoured to be here today to speak to you this morning about leadership. I have been a nurse for 39 years now, and I've enjoyed every single minute of it. There's been really difficult days, and there's been wonderful days. But actually standing here, seeing so many of you who are in the nursing profession, who are adding to the patient care across the Midlands, across England, Scotland, Ireland, Wales, is amazing. I'm going to start without the slides, actually, because I want to say Happy International Nurses Day to all of you for next week. Thank you. And I do want you to carry on that, because I want you to all give yourselves a round of applause for what you do every day and for making a difference to all of your patients and your teams. So well done, everybody. Big round of applause for each other. So I was asked to come and speak about compassionate leadership in nursing. And for me, leadership is not about being senior. Every single nurse is a leader. You can be a leader of a ward, a department, a service, a trust, or the leader of a single patient's care journey. You are all leaders. And compassion is one of the key values and key, it's a sense of feeling that nurses have. It is how we work. And without compassion, you can't have great leadership. And I know that you all have that. So I just wanted to go through a few slides to start with. So there are core principles for compassion in leadership. It centres around empathy, kindness, respect, the generosity of your time, the generosity of the care that you provide. That is what true compassion is. That is really important in nursing. We know that because our patients don't choose to be patients. We look after people at the most difficult time of their life. And it is a real privilege to be able to do that within nursing. But we cannot do it in the correct way unless we show real true compassion to our patients. Also to our teams, to our colleagues that we work with. And really importantly, and we'll talk about this in a few minutes, to ourselves. Because if you're not compassionate to yourself, you can't give compassion to others. The NHS culture is set against a values-based model. And part of those values has to be kindness, it has to be compassion, and it has to be a sense of doing the right thing for everyone. We know that compassion improves the quality of care for our patients. And we've read all of the literature that talks about when you're discompassionate or when you are incivil to each another within a team. We know that care is not the best it could be. So what is compassionate leadership? It's leadership that notices. It's leadership that's curious. It's leadership that responds and supports one another. And it respects each and every person, their individuality and the difference. There is a real role for emotional intelligence. We often sense and pick things up. We often manage because we have a feeling about here. We don't know what it is, but we know that there's something there. And that's that emotional intelligence and balance that you need. To be a truly compassionate leader, you have to be able to ensure that there is psychological safety. People do their best when they feel safe, when they can be open, when they can be transparent. I loved the question earlier about who's made a drug error, because actually we all have. So either we've realised it or we haven't noticed. But in nursing, we all make a drug error. In medicine, generally we all make a drug error. But that's what they are, they're errors. So we have to be able to be open. We have to be able to say when we get things wrong and learn from it and not blame people, because often it is not a deliberate act, it is a mistake. And then there's self-compassion. I mentioned this a few minutes ago. If you are continually compassionate, which you should be, actually you have to be compassionate to yourself, because if you don't, you start becoming emotionally burnt out. So compassionate leaders lead by example. They go home on time. They don't work 15 hours a day. So because there's no medal for the last person out the door. You have to be able to show the behaviour that you expect of others. And we should not expect people to be working hours and hours and hours past the end of the shift. We should not be expecting people to work without a break. We shouldn't be expecting any of that, because we shouldn't be doing it ourselves. So why does compassionate leadership matter in nursing? We know that it impacts well-being. If you have a leader who is not compassionate, who is not switched on to your needs, who doesn't understand you, it affects your well-being. We know that. We know that you're less likely to be a team if you have a leader who doesn't show the compassion that you need to build that trust. And we know that your resilience and motivation will not be as strong as it should be. It helps staff retention. We know that if you enjoy coming to work, if you're led by a leader who shows compassion, who shows kindness, you work in a team, you will come and support your team all the time. And actually, it's a joy to be at work then. So, again, the icebreaker talked about, is this a job you're passionate about? If you're treated well and you're passionate, you will come to work and people will stay at work. It actually improves your practice. You know that you come to work and you want to do your best, so you actually do extra training, you want to progress in your career. So it actually enhances practice, but enhances patient care. Because as you develop, your patients get better care. And we've already talked about open, honest learning. It is really important within nursing to have very open and honest learning. If we make mistakes, it is a mistake. But the most important thing is we learn from it. And I think that's quite difficult, because in nursing for such a long time, there has always been a sense of you've done something wrong if you make a mistake. And that shouldn't be the case. In the trust that I work in, we set up a learning system about a year ago, because I was very keen that people owned their mistakes, talked about them, and we learnt from them. So we have a system called Listen, Learn and Share. So we listen to what our patients tell us hasn't gone well or has gone well. We listen to all of our teams, all of our colleagues, and they tell us what needs to be done, what isn't going right. And then we share that information, we learn from each other, and we look at how we develop that into quality improvement. So true compassion is about being open and honest and dealing with the mistakes. It's also a core value of the NHS leadership. So the Constitution emphasises compassion, respect and dignity. And that's something that has run through the NHS for years and years. So we've already talked about staff well-being and learning from care failures. Inclusive practices allow you to become a compassionate leader. So by not saying, actually, you can join this team or you can't, or we'll listen to you, but we won't listen to somebody else, that divides team. So the inclusion of everybody's voice is important. We need to be able to hear everybody's voice in the NHS. And very often we don't. We hear a lot of the same voices all the time. So to be a really compassionate leader, you have to learn to listen to the people who don't speak very often, or who speak very quietly, or don't speak at all. You need to find those people. You need to always be curious, and you need to look for the gentle voice that doesn't shout. So key behaviours of compassionate leaders, things that you ought to be doing every day. Active listening. We've talked about this. You can listen to people, but you sometimes don't hear what they're saying. So you have to be truly actively listening to what people tell you and what people don't tell you. That's really key, because often that's the missing piece to the puzzle. Compassionate leaders have to be visible and approachable, or they are visible and approachable. Those people who you see wandering around the corridors who stop and talk all the time are those people who say, I've got an open door, and actually truly mean it, because you can knock on the door and go in any day. That's the sort of leadership behaviours you ought to develop. If you're a leader who's only available on a Tuesday morning at 10 o'clock, because you've got, you open your door for an hour, that is not inclusive leadership. That is not about being compassionate. That is about sectioning off. You are not only a leader for 10 hours a week. You're always a leader. You always have to be available. But you have to be fair and consistent. One of the best descriptions I ever had of me was that I was firm but fair. And I think that's good, because if you show consistency, people know where they stand with you. They know what your standards are, and they know what to expect. And if you do that all the time, everybody knows that. That builds a team. Everybody knows what is expected. Everybody knows what the standards are, and everybody knows how to achieve them because they get the right support. Empathy and role modelling is really important. I can guarantee that you can all sit here and think of the nurse that you don't want to be. That one nurse that was really horrible to you, either when you were a student or as a registered nurse. That nurse that's not kind to patients. That person sits in the back of your head all the time, and that's really important. But also very, very important to sit at the front of your head is the nurse who you want to be. That role model that you always remember because they were amazing. They gave great patient care. They were an amazing leader. They really looked after you. They were compassionate. They went the extra mile. That's who you always keep in the front of your head, because those role models are the people who drive us to be better. I can still very vividly remember the ward sister when I was a second-year student. I still want to be that lady. I met her 38 years ago. I'm not sure she's definitely not a nurse anymore. She's retired. But that is the person I still want to be. Supporting nurses through compassion is part of your leadership journey. It allows them to be psychologically safe. It provides a really good work-life balance. Recognition and appreciation is key to your leadership journey. The days that somebody said to you, thank you for what you did, that was amazing, stick with you. The days that somebody said, we want to give you this award because you have been chosen, is amazing. Recognition and reward can be a national award, or it can be a patient sending you a thank you card to say you've done an amazing job. Each of them is equally as important. Don't ever lose the thought that the very small things mean the most, because that's what your patients will remember. That's what your colleagues will remember. They'll remember the day that you said, that was a fantastic thing you just done. I've learnt such a lot from you. Or the patients will say, thank you so much for the care that you gave my mum. It meant such a lot at the end of her life. We have got the ability to affect so many people through such a long journey. And it is a privilege to do that. Reducing burnout in nursing is a leadership I must, actually, because very often we push our teams quite hard. We've seen a lot of burnout after the pandemic. People stayed. They kept working, it was difficult. There was a lot of psychological impact, and actually a lot of nurses burnt out. That's why I said your compassionate leadership and your ability to be a role model is important. So being a hero isn't the same as being a good role model. We do not want people to think that they have to burn out to be the best nurse. The best nurses find the balance that gives the best for their patients and their colleagues. I said right at the beginning, this has a massive impact on patient care. We know that incivility causes real damage to patients and causes real damage to teams. So supportive leadership enhances care. It allows us to understand the true value of compassion, the true value of care, actually, and kindness. Compassion and kindness is not pink and fluffy and soft. It is really hard to do every day. It's hard to come back every day and be that compassionate person. It is tough. You all do tough jobs every day. And you need to be able to recognise one another for that, and you need to be able to recognise from your team what a tough job they do. Being compassionate at the most difficult times is the hardest job, but for a patient, it makes the biggest difference. Patients will remember the cup of tea that you made, even if they didn't drink it. They'll remember the fact that you held somebody's hand. They will remember the nurses who run up and down wards looking really, really busy. And it makes a difference to them to stop and talk, to provide them with safe care. The one thing that patients always tell me is, for them, the most important thing is to feel safe. And that's what you do. You make them feel safe because you bring very skilled care to their bedside, to their home, to wherever they are. Patient-centred care is key to how we manage as nurses. Compassionate leadership allows your team to really truly look at what the patients need, because we listen to what our patients say, we listen to what our teams say, and we ensure that that patient-centred care sits at the very, very middle of what we do. It's at the heart of what a nurse is. So how do you create compassionate culture in your role as a nurse leader? Because remember, I said right at the beginning, you're all leaders. Doesn't matter what band you are. Doesn't matter what role you're in, you are a leader. So nurse leaders create compassionate culture through their action, through what they prioritise and how they respond to a challenge. So if we decide that actually we don't want to do the challenge today and it's too hard, that creates a very different environment. So we have to encourage our leaders to reflect. Compassionate leaders promote learning through reflection. We talked about this again earlier. And to be truly reflective, it doesn't mean you need to keep a reflective journal, but you need to have that little bit of time every day to have a think about, how did today go? What were the difficult things? What were the good things? What did I learn? We need to promote collaboration over hierarchy. The nursing profession is very hierarchical, isn't it? I know that. I've went through all these different layers to get to where I am. But actually, if we don't collaborate, it won't work. I've learnt that all the way through my career. The people who have the best ideas are the people who are delivering the care at the point of care. I cannot make things work by saying, we will do this. I can make things work in my trust by saying, how can we do this together and work together? And the benefits of compassionate culture is that well-being for our staff, better quality, better safety for our patients, and resilience in healthcare settings. but there are challenges to how we do this. Often we're very busy and we're resource constrained, especially currently with the financial constraints that we have. So we have a high workload. In a lot of areas, there's still some staffing issues and we have limited resources. But actually, we should never let things like that block us from actually being compassionate. There's obviously the impact of stress and burnout, and I'm quite sure everybody in this room has seen that in either themselves or in their colleagues, sort of post-pandemic. It's very difficult to get back from that, and it's very difficult to continue to give every day. And when that's happening, when you're having to support people through that, that is very tiring. We do also have to balance organisational demands. I'm quite sure everywhere you work, everybody's talking about government targets, how we get the waiting list reduced, how we save money. And often that narrative can become quite overwhelming, and you think, well, we have to just keep going, we have to hit a target. But often we don't realise that a target is a patient. So when we talk about waiting lists in the thousands, that's thousands of patients. When we talk about the 4-hour target in A&E, it's not a target, it's a quality standard. It's our jobs as leaders to turn that around, to not talk about numbers, targets, waiting lists, to talk about patients, to talk about what it means and safety and the quality of care. And then you as leaders need support as well. So you have to make sure that there is training, peer support, and that isn't always available everywhere. But you have to think of different ways around how you get that. You have to be really strong, and you have to say, no, we need a little bit of time, we need some help, we need some support. We have got, every hospital trust in the country's got CPD funding for nurses. We should be using it for some of this. So, nearly finished. Sorry, I was never going to take 10 minutes. I'm sorry. So my key messages are: compassionate leaders need to support the well-being of their teams because it enhances patient care. It sits with our NHS values. It sits with our nursing core values as well. Everyday leadership actions matter, so you're not just a leader on a Tuesday. It's every single day. It's what you say, what you do, how you do it. And it's the behaviours that demonstrate compassion that will get you through this. And leadership is everybody's job. Doesn't matter what role, where you work, that if you're behind theatre doors, if you're in ITU, if you're in the community, every nurse in the country is a leader. Now, I'm just going to click over that one because I put them in together. So I've got 2 very personal messages to all of you. And these are things that I talk about a lot in the trust that I work at. So you have the ability to impact people's lives, whether it's your patients, families, or your colleagues. And that impact can last a lifetime. You have got a choice. You either make it a negative impact or make it a positive one. I'm asking you to make it a positive one because it will stay with you. I can remember the people who helped me. I can remember what they said. They had a positive impact on me. And my last sort of message to you is, be the leader you want to be led by. In nursing, we talk a lot about give the care that is the right care for your mother. I always move this into a leadership space because if you are the leader you want to be led by, you will be the best leader. Because why would you want to be led by a dreadful leader and an incompassionate leader? So it's up to you. Be positive, be that leader. And that's all I'd like to say today. Thank you.